Good morning, everyone. I'm Jody Schwan. I'm the owner of Sioux Falls Business, coming to you today with a COVID-19 update related to our area healthcare systems. If you have been watching the cases and the way they've been trending, you know that we have seen a steady upward climb in COVID-19 cases statewide. With that generally comes an uptick in hospitalizations. That is what we are experiencing statewide now. So today what I wanted to do was catch up with the leadership of both health systems, get a sense for what they are seeing and what message they have to you, to the community, and to our business leadership. So I want to thank both of them for making the time to join me today. With me, I have Dr. Mike Wilde, Vice President Medical Officer of Sanford USD Medical Group, and Dr. Dave Basil, Vice President of Clinical Quality for Avera Medical Group. Thank you both for being with me today. I will not take too much of your time and hopefully hit on the high points that we really just need the community to know. So I am going to begin, Dr. Wilde, first of all, with just asking you to give me a sense today of what life is like within the Sanford system, specifically within Sanford USD Medical Center. What kind of demand are you experiencing, big picture, for your services?
Yeah, so right now we're seeing, I think, as you look around the region as well, an increased need for care, both from an inpatient and outpatient standpoint, both medical and surgical needs as well. We certainly are seeing an uptick in COVID cases, which I'd say was to be expected given the number of the events that have recently occurred, such as, people going back to school, a little more gathering, and we're certainly seeing, we thought we'd see a little uptick in hospitalizations from that, and we are, but the numbers from a COVID standpoint are really in the manageable range. There's been a lot of evolution and progress in regard to treatment, both outpatient and inpatient, and that has certainly helped. However, with that number of patients, we've also seen, we think, a little bit of an indirect effect of COVID, where patients that perhaps deferred some care are now coming into the system, needing some care. And typically, as you think back year after year, usually when school starts, it'll be a little bit of a lull, and then things start to kind of ramp up a little bit. And now we're seeing that in the setting of a pandemic, not only with direct effects of the pandemic, but indirect, where care may have been delayed in the spring and summer, and now people are seeking that care, and that's a good thing. There's certainly some needs that need to be addressed out there, and so we're always in a surge plan and have that mapped out pretty well, and we're executing on that at this time. And so we're prioritizing patients, moving them around, working with our great partners out in the rural facilities as well, really trying to get care as best and quality and safe as close to home as possible.
And I think people might be surprised to learn that there are times pre-COVID where our area hospitals are essentially full. It gets that busy for one reason or another. Dr. Basil, give me a sense today of how the state of things within Avera compares to some of those other times. How busy are you?
Right. So if you think about it overall, on a daily basis, we might have 100 admits and 100 discharges on a given day. And so we've got a transfer center that's essentially an air traffic controller to handle all of those logistics, because you've got to get all of those folks out of bed that have gotten better and going home to make room for all the people coming in that day. And so, like you said, pre-COVID, it wouldn't be at all unusual for us to have some admits that are waiting for the discharge for those beds to open up to come in. And also wouldn't it be unusual for us to be talking across our system. We've been building for 25 years to get standardization across our 37 hospitals. So we share a common electronic medical record, radiology, processes, procedures. Even, physicians will go back and forth and very comfortable, fit right into the different things. And so most of our cases can be handled at any one of those 37 facilities. It's just when you need a little bit higher level care that you need to come into, say, a bigger facility, or if you need neurosurgery, those sorts of things. And so it's not uncommon, even pre-COVID, to have a lot of shifting back and forth. Now that we're into that, I totally agree with Dr. Wilde that we're seeing that effect of the kind of that deferred care has certainly been raising its head. When we were really shut down through April and May, people still need to get their cancer staged. They still need to get a lot of that other preventative care. There's only so long you can turn that things down. And then you put that into the mix of we're definitely seeing that increase of cases coming for all the reasons that we've talked about. The good news is we still, we are in general below our capacity, but there are times that, there's people backing up a little bit, waiting for those discharges, waiting for us to determine where's the best place for them, but not uncommon in the big picture.
Okay. Give me an idea. You each at one point earlier this year decided to hold off on many of those elective procedures. You've brought them back over the summer. Are you evaluating things? Are we at a point where you might need to hold off on those again, or do you feel comfortable with where you're at?
I can maybe take this one first, because I think, kind of like Dr. Wilde said, one of the real blessings we had through all of this is in that April and May period, we had time to really hone those surge plans. And we put them into place. We took pretty drastic steps at that time, opened up new ICUs, opened up new hospital wings, really opened up multiple different ways to handle a higher number of patients. And so we had that dry run and that practice of getting everything in there. And it's a very stepwise fashion. So as we do see numbers continue to increase, we can reactivate any of those plans. And so that may very well include, if we get to see numbers continue to rise, we may have to shut down certain more elective procedures until later. Again, we're not at that point, but we do continue to look at that, and we may get there. If we do, we've got the plans in place, we've got the people in place, and so, yeah, we're ready for that.
Dr. Wilde, how about at Sanford? Are there any thoughts about going back to delaying some of those elective procedures yet?
Absolutely, part of our surge is to consider things like that. But as you look at what was delayed earlier this year and what we've learned nationally and just what we've learned from treating patients with COVID and exposures and risks to others, elective surgery doesn't necessarily equate to recreational surgery. I mean, we're talking things where people are really suffering and miserable, whether it's cancer diagnosis or a redo procedure of some sort, or addressing a complex heart issue. And so these are people that need care as well, and they're coming in, and we need to be there for them. And so we anticipate that's going to continue. If there is opportunity to move things back later in the year, we certainly may consider that. We are not at this time. We, of course, are also looking at where we're at with staff and their safety and also our personal protective equipment, and we're doing just fine from that standpoint. So there's no reason we cannot continue. We still have that capacity, although working hard right now, and anticipate that will continue.
I'm going to have each of you address this, and I'll stay with Dr. Wilde here if we could. As far as just the geography of care, I guess, because you both serve such broad geographies. And I was surprised at one point, not that long ago, maybe last week, to learn that there were patients coming for care in Sioux Falls, in some cases from across the state, in some cases from other states. Who are you caring for in Sioux Falls right now? And are you having to make decisions to keep beds available if people in this area were to need them? Or is it possible that I might be a Sioux Falls resident ending up in a hospital bed somewhere else in the state?
Yeah, so that has been the interesting thing, and it kind of takes me back to the flu season, which we're very familiar with every year. And it seems like it will always start internationally, and then the more populated areas in the coast, and then eventually makes its way to the upper Midwest, including the small towns. And I'd say that's really what we're seeing right now from a COVID standpoint. Is it's really kind of one patient here, one patient there, from really all over. The majority of the cases are not inpatients or patients requiring hospitalization from Sioux Falls, although there are some of those, but really coming from anywhere. And that's what we are. We're a care center for the people of the upper Midwest. And so we're going to be here when you need us. Now, That being said, we prioritize the care as people are geographically in an area. If we can meet their needs, including real-time connectivity to experts here in Sioux Falls, to experts out in the region, we're going to do that. We're going to prioritize who may need care right in Sioux Falls versus who can have care a little closer to home. But and then we're also trying to be good stewards for our partners across the upper Midwest. So if you're geographically in an area well outside of Sioux Falls, you may wind up in Sioux Falls based on needs in that area. And so we certainly want to be there to meet the people's needs as close to home as possible.
I think it has to be a little bit of a challenge just trying to logistically figure this out. Dr. Basil, where are you at within Avera trying to manage across those geographies?
Yeah, very similar sorts of situation. Again, pre-COVID, probably 50% of the patients in Sioux Falls at any given time were not from the Sioux Falls metro area, because that's what it means to be that regional referral center and to bring people in from multiple states in any given day pre-COVID. And so we're very used to working with that. And it's, again, similar sorts of patients get cared for a similar sorts of way all across our system. It's only if they need that higher level of specialty that maybe is not available locally, or that higher level of complexity, that we bring them here. And a lot of times we'll, even pre-COVID, then we'll send them back to their local hospital towards the later stages of their care so that they can be closer to home, more comfortable circumstances, and to allow room for somebody else to have that level of care. And so that's a continued logistic challenge that we've been used to managing for years.
Are you seeing, and I'll stick with Dr. Basil, then Dr. Wilde, I'll ask you the same thing. Are you seeing any differences or any trending as far as the symptoms that COVID patients are presenting with, or the duration of their stay? I know in the spring, once you were admitted, often you were in the hospital for more days than normal, let's just put it that way. How has that been trending?
Yeah, we've certainly gotten better over time at managing and treating COVID patients, I would say. And so I would say a lower percentage of them stay in the hospital for a month, 6 weeks than we had initially. We've gotten things like convalescent plasma. We have a Regeneron antibody trial going on right now. We've learned about dexamethasone, all of these different late intubation or putting people on breathing machines later than we did initially. And so all these things we've learned about COVID do help us manage them quickly. And we've also learned of what to be worried about in patients. And so we probably send patients back home a little bit earlier, knowing who's likely to relapse. And we've even managed, a greater percentage of patients at home with home care and remote home monitoring and those sorts of things. And so we have learned quite a bit during this. I would say as far as symptoms, they stayed pretty much the same. We still continue to see, hitting the older age groups higher, though we still get ones in the younger age group, but that's been pretty constant.
Dr. Wilde, what do you think as far as length of stay, and as well as, the symptoms that land you in the hospital? Because I feel like there's such a broad range of them. Symptomatically, what needs to be going on for you to even be put into a hospital bed?
Yeah, so we've certainly have had a rapid evolution of care and really learning best practices nationally, internationally, and even within Sanford. We have weekly meetings with our intensive care unit clinicians across all of Sanford, in addition to our primary care as well, just really lifting up those best practices, what's working, how can we always do better. And I think we've had some good progress there. Certainly the treatments have improved some of our outcomes, delayed that ventilation, and lessened the length of stay. We've also had good success working with our partners in our rural communities, in addition to our long-term care partners at Good Sam, transitioning those patients that no longer need acute hospitalization, but still need some further care and monitoring, and how can we transition that? But then patients themselves have done a really nice job of listening to the message of call first, and certainly isolate at home, taking care of themselves at home. And we do have a home monitoring program, which has been lifted up as a best practice. And we've learned that from other areas as well, that we can safely monitor you at home if you're just kind of on that border. But certainly, absolutely will advise that you come in if symptoms such as, lower oxygen levels, higher fever, cough, shortness of breath, are really some of those symptoms that could wind up having someone in the hospital. But we are seeing the people needing hospitalization, again, more that obesity, other medical conditions, and older age. And so those are the folks that are certainly the most vulnerable.
Okay, I will ask each of you this next one as well, and that is that we have talked so far about sort of the physical capacity within the facilities, the beds themselves. You need people to provide the care, and I know I am hearing anyway that workforce availability is starting to become a bit challenging in certain areas. I'm certainly not suggesting that your workers are catching this at work. That's not what I'm hearing at all, but they're out in the community and being exposed, and I'm hearing getting sick and unable to come to work. Talk to me a little bit about what that situation looks like, and if you've got a message for employers who, if they're not already dealing with something similar, might soon be.
Yeah, I'll start with that. And we have prioritized our workforce all throughout COVID. Obviously, we found ourselves in the middle of a pandemic and rapidly tried to evolve, and realized that our workforce was going to be crucial, and supported them through this entire time. They've been working hard. We are not seeing spread within this facility, and people are doing a nice job with the principles of infection prevention. As an employer, we've been having those HR policies in place because we're humans within this community, and so people do want to get out. People want to recreate. They need to take care of their families as well, and unfortunately, that can lead to some illness from time to time. So that clarity in regard to if you're a healthcare worker with an exposure, when can you come back to work safely and things like that. As an employer, I'd really be focused on my HR policies in those scenarios as to if there is a vulnerable person at home, how can your employee take care of them? What does that look like? If there's an exposure or if there's an active case, what is your HR policy in regard to how long that person should be at home? And the state health department, in addition to the CDC website, have pretty clear guidance on that. And so I think those are the decisions and that clarity that you need as an employer. And we certainly do that here as well, and certainly see those vulnerabilities as humans within this community.
Dr. Basil, what does your staffing situation look like today? And do you expect that it could present some challenges if it's not already?
I would agree that from a infection control standpoint, we've really learned that face masks and face shields are incredibly protective, and we have almost no transmission within that sort of a setting. Where we start to see people come down with this is often, it's at the lunchroom setting where they sit at the same table and have lunch together and let down their guard, and one person then turns up positive, and you've lost all 3 or 4 of those people sitting at that table type of situation. And then certainly community exposure. One of the most important things I think to think about and to get the word out about is don't come in with any degree of symptoms, and that's no matter what your business is. That's the other thing you come in with. You've got relatively minor symptoms, and we've all been conditioned for so long, work through those sorts of symptoms. It's just a cold or whatever. And time again, we've seen, some of those people are going to end up having COVID with just mild symptoms, and they've taken out a whole swath of people before they finally come forward and get tested. And so that's such an important piece is don't try to be a hero at any signs of infection. Get yourself isolated and get yourself tested so that we don't lose even more of our workforce through that way. And it's hard for all of us from that standpoint. It's denial is really a big part when you've got relatively mild symptoms, and being able to think about that bigger picture and the implications of that. And also that HR policy point is a good point. What happens, as far as vacation time and all of those policies when somebody does come down exposed or with that, or you have a child who's exposed. Those are all important things that play a role into here, and how companies can support their workers through this.
I will tell you, and just in talking to both of you, neither one of you seems particularly alarmed to me, which, I'll take as a positive that we have this, more or less under control at this point. I also know that we're coming off of days of record reported new cases, and that it takes time before those people show up in your hospitals, at least historically it has. So with all of that in mind, do you have any just final thoughts or messages to the community in terms of what you need to be seeing from them, what you'd like to be seeing both in their day-to-day lives as well as for our business leaders watching in the way that they are managing through this within their organizations?
Hospital beds are not an infinite resource. And even if you see the total number of hospital beds look like they're doing pretty well, you've got to pay attention to like the higher level acuity beds, like critical care beds, because even though we've been able to shorten the length of stays on a lot of these cases, once you end up in the ICU, those length of stays are still staying pretty high. And so while I totally agree, we're very comfortable with where we are right now. We've got capacity, we can shift around capacity within the system. If numbers do continue to escalate, that could be a problem sooner rather than later. And so anything that the business community can do to help us keep those numbers under control through those policies with your workers of getting them tested at the first sign of symptoms, encouraging social distancing, think about your break room policies, all of those sorts of things. It's not infinite, and we will come to a point, if it keeps escalating like this, that we will have to make harder decisions about things like elective procedures. We're not there at this point, but anything we can do to keep a lid on this, keep everybody's business open, keep the economy going is good.
And I would just take a little different direction on that. Number one, just this is an unexpected pandemic that, it can happen, and it obviously has happened and spread across the globe, and it's still with us. And my encouragement to everyone is just hang in there. There's, vaccine is on the horizon. While it's not going to be perfect and, things like that, we're going to be okay. It's keep up the good work and thank you. People out there are taking care of themselves. They've been practicing the good hygiene. There's some slips and things like that. And, I'm guilty, just like the next person, of putting your hand in the wrong spot, not taking a moment for hand hygiene, things like that. Those things happen. It's okay. But just in general, try to stay persistent on that. Don't let your guard down. Get your flu shot because there's other illnesses out there that we'd like to have people stay away from the hospital with, and influenza is a great one where you can get that flu shot and get that taken care of. But hang in there, be smart, be responsible. And I think Dr. Basil put it very well in that we're accustomed to dealing with surges of patients and working through that process. We're seeing a big one right now. We're working through it, and just be patient, hang in there. We have people that are working really hard for you, and we're going to keep doing that and hopefully get through this. And that's certainly our plan, but help us out. Just continue to keep up the good work that you're doing.
All right, thank you both very much. Thank you to your teams for all the work that I know they have done all year and certainly are continuing to do right now. We will keep you updated as we have further developments related to both our health systems and the broader community with the impact of our rising surge in cases. I want to thank again both of you for joining me. I want to thank everybody else for watching. If you do have questions, feel free to comment. We certainly will do our best to get those answered for you. Have a great rest of the day and a great week, everybody. Thanks very much.